Emotional neglect occurs when a parent or caregiver consistently fails to provide the emotional care, attention, and affection a child needs to grow up healthy and emotionally balanced. Unlike emotional abuse, which directly harms a child through harsh words or actions, emotional neglect is often silent. It can be subtle, like refusing to hug a child, ignoring their feelings, or not listening when they want to share something important. Neglect can happen for many reasons. Others may struggle with mental health challenges, addiction, stress, or simply lack the knowledge of what a child needs at different stages of development. Whatever the cause, the impact on the child can be profound. Children who experience emotional neglect often feel unloved or unwanted. They may struggle to trust others and have difficulty forming close relationships. They can develop low self-esteem, depression, anxiety, or emotional withdrawal. Some children act out, seeking attention in negative ways, while others withdraw completely, appearing indifferent or uncaring. The signs of emotional neglect can be both emotional and physical. Emotionally, a child may feel lonely, struggle to manage stress or anger, or have trouble recognizing or expressing their feelings. They may become overly attached to strangers or avoid emotional closeness with family. Physically, signs can include dirty clothing, poor hygiene, malnutrition, or lack of supervision. At school, neglected children may often be absent, steal, beg for food, or lack basic medical care, like glasses or immunizations. Neglectful parents often display behaviors such as indifference, apathy, depression, excessive use of alcohol or drugs, or speaking in a cold and unfriendly tone. They may show little interest in their child's life, offer minimal praise, or spend limited time with their children. They may fail to respond to a child's emotions or discourage them from expressing themselves, which can reinforce feelings of unworthiness. The long-term effects of emotional neglect are serious. Children who grow up neglected are more likely to face behavioral problems, psychiatric disorders, substance abuse, and difficulties in forming healthy relationships. They may struggle with intimacy, trust, and emotional regulation, challenges that can continue into adulthood. Physically neglected children may also experience long-term health issues. However, it's important to understand that emotional neglect is not always intentional, or because they are overwhelmed by stress or life circumstances such as poverty, divorce, illness, or disability. Young or inexperienced parents may also simply not know how to meet their child's emotional needs. Children who have experienced emotional neglect can heal with the right support. Therapy, nurturing relationships, and consistent emotional care can help them learn to recognize, understand, and express their emotions. They can rebuild self-esteem, develop healthy coping skills, and form meaningful connections with others. Breaking the cycle of emotional neglect often involves both helping the child and supporting the parent. Parents can learn healthier ways to respond to their children's needs, understand their own emotional patterns, and provide consistent care and attention. Professional guidance, such as counseling or therapy, can be invaluable in this process. Ultimately, addressing emotional neglect early is crucial. By recognizing the signs of neglect, providing emotional support, and fostering healthy relationships, we can help children grow into emotionally resilient, confident, and connected adults.